Good afternoon. Thank you so much for tuning in. I am honored to be able to speak and to celebrate the achievements of the graduates today. I would like to take a moment to thank my parents, friends, and faculty mentors at the School of Nursing, especially my PhD co-committee chairs, for the love, support, and patience offered to me every day of my academic career. I would not be where I am today without you. In light of this pandemic, which has produced the most challenging national health emergency that our generation will likely face, I want to take a moment to thank our healthcare workers who put their lives at risk every day in an effort to combat this deadly virus. I graduated with my Bachelor of Science in Nursing from UT Austin in May of 2013, and my Master of Science from the Psychiatric Mental Health Nurse Practitioner Program in May of 2018. Today, I will graduate with my doctorate in philosophy from the School of Nursing. Yes, there are PhDs in nursing. Between my undergraduate and graduate degrees, I have spent 11 years in the School of Nursing, and I am deeply grateful for every single one. I've gained valuable knowledge, met lifelong friends, and connected with outstanding professors, some of whom are now my colleagues. When considering what message I wanted to convey today, I kept meditating on unity and leadership. There are many skills, attitudes, and aspirations that developed in me during my doctoral education, all of which I deeply value. However, if there is one aspiration that I could instill in every nurse, it would be to feel passionate for growth and change in the role of nursing in our healthcare system. In the sharp, revealing light of our current national health emergency, it is clear that our healthcare system and the voice of nurses within it must undergo major changes. I would hope to create the courage and passion for those necessary changes now, with nursing as a profession speaking up together using a unified voice. I am also aware of the profound exhaustion and drained energy many of my colleagues and the students I teach feel. It also weighs on me. Just in the last few months, many of us have navigated completing coursework, clinical hours, family obligations, and maintaining safety, all in the midst of a global pandemic that had many areas of our lives changing on a daily basis. You have overcome these significant challenges in an alien and sometimes threatening environment. Let's take a moment to applaud that you made it to the finish line despite these obstacles. I hope you all get a much-deserved break, a mental pause to breathe, relax, and bask in your accomplishment. During your mental pause, I strongly encourage you to take the time to reflect on your highest aspiration for your professional growth, your profession, and your healthcare system. Because now, I'm going to make a call to action. In the coming months and years, it will be imperative that we join together to push for policy and legislation changes to support our profession and change our healthcare system. As Viktor Frankl, a Holocaust survivor and author of Man's Search for Meaning, a book that detailed his experiences as a prisoner in Nazi concentration camps and described his psychotherapeutic method, which involved identifying a purpose in life, once said, "Between stimulus and response, there is a space. In that space is our power to choose our response. In our response lies our growth and our freedom." As nurses, we have been trained to utilize the space between clinical stimulus and our response to best address our patients' needs as intelligently, efficiently, and effectively as possible. Today, I will challenge you to expand the use of this space beyond your job demands and your patient interactions, and join together to become leaders in our healthcare system. Our national health emergency has clearly demonstrated that our profession is on the front lines of a broken healthcare system. Many gaps in our healthcare system's response and preparation were highlighted over the previous months. I believe these could have been mitigated had nurses been on the forefront of our government's and our healthcare's leadership. Nurses comprise the largest segment of healthcare professionals in the nation, and nurses have been rated the most honest and ethical profession according to Gallup surveys of Americans over the last 18 years. Yet, we are lacking strong professional engagement and so have relatively weak political representation. We need to change this to allow our voice to be heard in councils of political power. Let me share some numbers with you to highlight the potential power of the nursing profession. There are 300,000 registered nurses in Texas, yet less than 5% are members of the Texas Nurses Association. There are 25,000 nurse practitioners in Texas, and only 5,000 are members of the Texas Nurse Practitioners, which is only 20% engagement in a major professional organization that represents nurse practitioner interest in our government. The percent engagement looks the same across nursing specialties. I mention these numbers to show where we can put in minimum effort just joining our professional nursing organizations to achieve gain in our political voice. When we speak to power with one unified voice, things will change for us. I have seen firsthand that our professional organizations are actively advocating for nurses, educating them on their rights under the law, and getting nursing messages out to local and state political leaders. It is easy to take for granted the autonomy and the benefits of our nursing positions. I am here to tell you that there are other leaders in the healthcare system that are counting on our complacency and possible apathy to further subject us to greater restrictions and more work demands. For example, recently, another healthcare professions board tried to pass statewide rules that would have severely restricted advanced practice nurses' practice and possibly shut down many rural clinics across the state. This was caught by advanced practice nursing organizations in Texas, such as Texas Nurse Practitioners. These organizations went to bat for us and ended up blocking these rules from further restricting APRN practice in Texas. When nurses are not sitting at the table with other healthcare leaders, actively involved in hospital, community, and legislation decisions, our profession and our patients suffer. I know we are tired. We spend 12-hour shifts hustling to put our patients' needs above our own. We stay late to check up on labs, coordinate care, and are constantly keeping our knowledge up to date and our minds sharp to best serve our patients. Our system is built in a way to create fatigue by increasing patient-to-staff ratios, bureaucratic demands, charting demands, and placing the burden on nurses and other healthcare workers. But I hope this pandemic has made you all aware of how strong and capable you are of navigating complex systems and adjusting to profound changes quickly. Let's use that momentum. I encourage each and every one of you to join an appropriate professional nursing organization. Within it, you may find interesting opportunities to volunteer on a committee on something that you care about, or opportunities to call or mail your legislative representative on an issue that is important to you. This may look different at every level of nursing. Whether you are earning your bachelor's, master's, or doctorate today, there is a role for you. Even if you are new to healthcare or committee involvement, I encourage you to offer your energy and fresh insight to local chapters of your nursing organization. If you are experienced with professional organization and leadership involvement, I encourage you to mentor and invigorate those who are looking to get involved. When we are part of a professional nursing organization, our voice is multiplied many times over. These are just starting points, but important starting points. To most effectively improve our patients' and profession's well-being, we have to be leaders in healthcare policy and changes that improve the experience and outcomes of our patients and our fellow nurses. Certainly, we deserve to bask in the sense of accomplishment that we have all achieved today. But we should also identify our next goal soon. While our minds are still embraced by the certainty that we can achieve lofty and challenging goals. Let's set our sights high and look for opportunities to speak up in our unified voice. Always remember, we are Longhorn nurses. What starts here changes the world, and what starts with us changes healthcare. Thank you, and hook 'em.